Hello, I'm Bill Wagner from the McGowan Institute for Regenerative Medicine at the University of Pittsburgh. And I'm going to give you a very brief overview of what the Institute's about, what our mission is, and what we're doing right now. For more detailed information, however, I would refer you to our web address, mirm.pitt.edu. So to really understand the McGowan Institute and why we're in Pittsburgh and why we have the mission that we do, it's important to understand transplant, the history of transplantation in Pittsburgh, and Thomas Starzl. Tom Starzl was a pioneer in organ transplantation. And when he came to Pittsburgh and started his key innovations in immunosuppression for organ transplantation, Pittsburgh became the center of the world for organ transplants. And as a result, patients from around the country, from around the world, would come to Pittsburgh hoping to have an organ transplant. Then, as even still today, there were not enough organs to go around. And as a result, Pittsburgh became a place with a lot of patients in end-stage organ failure. So it became a natural place for industry that might be developing an artificial heart, an artificial liver, to ethically test in a patient population their organ support technology. So that was particularly true with artificial hearts. So an artificial heart program was built here in Pittsburgh in the late 80s, early 90s. And many patients came that were, virtually all those patients were on the list for transplantation. One of those patients that came was an individual by the name of William McGowan. And Bill McGowan was founder of a company, MCI. If you're my age, you understand what that means. If you're younger, you may not know what MCI is. But MCI was a disruptor in the phone company business. It used to be a monopoly, AT&T and Bell. It was a large monopoly that the government approved of. And Bill McGowan broke up that monopoly and said, it's not fair that this one company has all the phone business. So he was a type A personality. He had advanced heart failure, and he came to Pittsburgh. And he learned that there were not enough organs. And as a result of that interest of his in what happens in people that are in end-stage organ failure with heart failure, he gave money to begin what was then the McGowan Center for Artificial Organs, specifically artificial heart development. So McGowan Center was launched in 1992 and was focused on developing better artificial hearts. And the key ingredient that happened at the very beginning with McGowan was the recognition of having world-class clinicians that really understood end-stage organ failure and bringing in world-class engineers. And then working with companies that already had a technology that might be ready to go to clinical trial. But the key of having the engineers side by side with the clinicians to understand how the best technology in the world was not good enough. Every engineer wants to see failure. If they're being asked to design a better mousetrap, show the mousetraps and how they're failing. That's where the ideas come from for the better mousetraps. So a key ingredient of McGowan has always been tight integration between clinicians and engineers. Then the other piece of that is students, is trainees, residents, fellows, graduate students, undergraduates even in the laboratories, because they're really going to carry the ball forward into the next generation. And what they learn in that front row seat of the clinical environment inspires them and drives them in the future. So the McGowan Institute has grown since that time. It's now about 250 faculty members, mostly at University of Pittsburgh. We do have a significant number of engineers at Carnegie Mellon University that participate, and a few at some of the other universities in the region. And those faculty interact on a wide variety of topics. But our primary mission is quite simply develop technologies that address organ and tissue failure. The key corollary to that mission is if it does not get to the patient, we have not fulfilled our mission. So as a result, we have to understand that pathway from laboratory to patient. And I'll tell you, the secret is it has to go through a company, and someone has to be able to make money. Someone has to invest. Large amounts of capital have to be invested to get the technology to the patient, because going through the regulatory process, the manufacturing, quality assurances, et cetera, is extremely expensive, and it takes a long time. So you have to have the wherewithal to get through that. If you're going to attract that kind of investment, you need to understand the patient and the market. It's really the same thing. You want to do best for the patient, but you need to understand how much better you need to be to displace the current technology. So, of those 250 faculty members, many of them are some of the most prolific inventors, innovators on campus. And if you look at patents filed, if you look at companies formed, you'll find that the McGowan Institute is a collector of those personalities, those individuals, clinicians, engineers, et cetera, that invent and form companies. In fact, we formed 33 spin-out companies from the Institute. We have filed over 1,080 US patents and even more international patents. So that's a key first step in being able to attract the investment that will eventually lead to commercialization. Let me go back a moment, though, to Bill McGowan in the early years of the Institute. Back then it was called, like I say, the McGowan Center for Artificial Organs. So one of our first efforts was focused on developing a blood pump, a circulatory support device, with the radical new concept of using a rotary blood pump. In other words, having a turbine that would spin. And the turbine had to spin at about 10,000 rotations per minute. So a lot of people, myself included, thought that if you did that with blood, you would break the red cells. You would lyse the red cells, and it would be terrible for the patient. Turned out, fortunately, I was wrong. A lot of others were wrong. And you can design a blade, a rotary blade that spins that fast and does not damage the blood. And in fact, we received a contract from the NIH in the mid-90s, worked with a small company out of Sacramento, California, and that became the HeartMate 2 continuous flow ventricular assist device. It is now the most implanted circulatory support device in the world. It's at the end of its lifespan now. I mean, we developed it in the late 90s. It entered the market in the early 2000s and had a significant run of supporting thousands of patients. But now it's at the end of its lifespan. But a huge impact we were able to make by developing that pump with that small company. Most importantly, there's a graphic showing the blood pump and how it interacts with the heart. But there's some numbers there. 82% is the survival rate if you get a transplant after having a heart transplant at 2 years. If you get the blood pump instead of the heart transplant, your survival rate at 2 years is 76%. So it's not as good, not quite as good as a heart transplant, but it's getting close. And that's a huge step from where we were when we started that contract in the mid-90s. So another area that we began to work in back in the earlier days was artificial lung development, and trying to get to a scenario where a patient that was in end-stage lung failure would have the same quality of life as someone in end-stage heart failure, meaning that they could walk around, they could leave the hospital with a blood pump, they could leave the hospital with an artificial lung. I'll tell you the answer, we're still not there. We haven't achieved that, but we've made significant progress. So one of our innovators, Bill Federspiel, worked with a clinician, Brack Hatler, and they developed a booster lung, if you will. It's like a mini lung. And the advantage of making that smaller device is it was easier to hook up to the patient's blood supply. It wasn't as major of a procedure to hook it up. And that device could remove carbon dioxide and transfer oxygen, not enough to take over all of the lung function, but enough to possibly keep someone from needing to go onto a ventilator. Now, if that sounds familiar, it's because we've just gone through this terrible pandemic. We're still, I guess, worldwide, we're still very much in this terrible pandemic of COVID. And one of the key objectives clinically is trying to keep patients from needing to go onto a ventilator. So this device had just received approval in Europe and was in the process of testing with the FDA in the US when last spring COVID was spreading. And the company was able to receive emergency use authorization, and I'm happy to report has treated over 100 patients with their technology in efforts to keep patients off ventilator. And there's a lot of clinical summaries out there that are accessible on the internet that summarize how effective this has been. But suffice it to say, we were delighted to be able to have something that might offer some hope to those patients. The market, though, for this outside of COVID was for other patients in end-stage lung failure, and again, try and keep them from needing to go onto a ventilator. Another aspect is Dr. Federspiel has been working to downsize it to make it applicable for children. And this has been a major effort in the McGowan Institute in general, is to make devices for children. We've partnered with Children's Hospital of Philadelphia, Children's Hospital of Pittsburgh, and have a grant from the FDA where we specifically are looking to fund projects that are focused on pediatric device technology, pediatric regenerative medicine. Another technology that's developed that's outside of the pure device area, more in the stem cell or cell therapy area, is from a laboratory of Eric Lagasse, who is one of our faculty at the McGowan Institute. And if you're a fan of the TV show Grey's Anatomy, you may be familiar with this. If you're not, I'll tell you what happened is the writers of that show heard about Eric's work, and they wrote it into their script. And their main character, you can see a picture of her, she was doing a procedure where she was removing lymph nodes that had tumors. The tumors had spread to the lymph nodes. And she made the comment, wouldn't it be great if this was functional tissue instead of tumors? And there was this big aha moment. And she said, wait a minute, I've got this idea. What if we tried to grow organs in lymph nodes? And that became part of the plot. But the real idea, the real life situation was Eric Lagasse did have that idea. And he spun out a company called Lygenesis. And Lygenesis has just received approval from the FDA in 2021 to begin a clinical trial, a phase 1 clinical trial. And what they will do is they will take organs, livers specifically, that have not matched to go to a donor and would be discarded otherwise. And they will isolate, the company will isolate the liver cells, and a physician will inject them into the lymph nodes of a patient in liver failure. And then if it works as it's worked in the laboratory, over weeks to months, those patients will develop mini livers in their lymph nodes in their gut. And the expectation is they will not need to have a full liver transplant. They will have these mini livers taking over the function. Another project that we've spent a lot of time with is it really epitomizes kind of partnerships we like to form. I mentioned the one with Children's Hospitals of Pittsburgh and Philadelphia. This is a partnership with North Carolina A&T University in Greensboro and University of Cincinnati. And it's been a 12-year effort where we've sought to really revolutionize metallic biomaterials. So if you go in for an implant, a hip, a knee, a stent, any one of a number of medical implants that have metal, the metal is designed to be there longer than you will be. It's designed to stay there and do its job. In other aspects of medicine, we have materials that degrade away and don't leave a permanent, as we say, permanent foreign body, which is not a great thing to have in your body. So what if we could make metals that would degrade in the body? The chemistry is easy. Magnesium, zinc are two metals, alloys of which will oxidize in the body and degrade away. So what if we focused on developing alloys and devices out of those alloys? So in the image, you can see some of the work from that collaboration with North Carolina A&T, where we've made artery stents, we've made bone screws, we've made stents for the trachea for babies that have collapse of the trachea, and even support structures for tissue engineered heart valves. So just an example of, like I say, the types of collaborations. So I'll wrap up there. I haven't even begun to go into the detail of the cool things that are happening, but the key, I think, take-home point is Again, our mission, develop technologies that address organ and tissue failure and getting it to the patient, and recognizing that to get it to the patient, we have to do things like form companies like A-Lung that you heard me talk about with the lung device, Genesis with liver technology, and many future many future spin-out companies that are in the works right now. So thank you for listening, and I hope you have the opportunity to learn more about the McGowan Institute in the future. Thanks.